What about modification of the nasal tip? Nasal tip lectures can take up an entire day, so we'll just talk about a couple of things. Now, I've broken it down into three main issues that come up when folks talk about wanting to modify the tip of their nose. One is the rotation, and we mentioned this earlier. How far up or down the nose tip is upturned or downturned. The definition of the nasal tip. Often folks feel like they want it to be a little bit more refined looking, and also the size. So those are the three main issues. Now, how do you rotate the nasal tip up and down? Well, you do it by manipulating those nasal cartilages of the nasal tip, these lower cartilages. This is just, again, that diagram I showed earlier, looking at aesthetic ideals for nasal tip rotation. And I think computer imaging is a really nice way to demonstrate this to patients in consultation to determine sort of what rotation would look best for them. Now, this tripod that's drawn here is actually drawn there because we actually use that concept when we think about how far and how much to rotate that nasal tip up and down in the operating room. By shortening these upper limbs of this tripod, this tip will go up. By lengthening them and shortening this leg of that tripod for those cartilages, we can actually make the tip drop, which we need to do in some cases, which I'll show a little bit later. This is the patient I showed a little bit ago, just demonstrating this angle has been altered by using that tripod concept in addition to doing the things to the other parts of the nose. And again, there are no cookie cutter rhinoplasties. The amount of rotation that we perform depends on gender, height, ethnicity, patient preference, and a lot of other things. So we use computer simulations to determine what might look best. Definition is one of the other things that patients often come in talking about with the nasal tip. And the definition of the nasal tip is created by these so-called tip-defining points, and they're exaggerated in this model on the left-hand side of the screen. In fact, that would probably not be ideal to have that much light reflecting off of 2 points like that. But it's created by the highest point of these lower cartilages and the curvature of these lower cartilages. So by altering that with sutures, or by cutting them or doing other things, we can actually create a new nasal tip and new nasal tip defining points for the patient. This is an example actually of somebody who had too much definition there and wanted it to be reduced. And this is what we call a Bifid nasal tip, sort of like that idealized drawing which I just showed you. And she has very prominent cartilages which are separated by a cleft, and this is something that had bothered her for many years since adolescence. And by simply going in, actually there's some asymmetry in this area as well down below. By simply going in and manipulating those cartilages using suture techniques, we can actually get them into a more symmetric and aesthetically pleasing conformation. Pretty subtle, but made a big difference for this patient. What about nasal size? The ideal nasal size will be affected by ethnicity, and achieving balance and harmony for the face. If somebody has a round face, giving them a very thin nose can look very strange. Likewise, someone with a very thin nose goes a very round, out of balance. So face. This is what we talk about, what we mean when we talk about balance and harmony in the nose. And this aesthetic dorsal line that was mentioned earlier probably is something to think about. I think it's a reasonable thing to consider in terms of an aesthetic outcome for a rhinoplasty. And on base view, there's this idealized triangle that we try to achieve. Again, I think this is somewhat ethnicity dependent and patient dependent. So this is somebody who had a rounded, or what we call a bulbous tip, who wanted, in addition to a few other things, to change the configuration of her nose such that this roundness, which is showing up here, and there's a piercing there, which is a little distracting, but the roundness of the nasal tip is sort of out of balance with the way this aesthetic line comes down. And if we draw the aesthetic line before surgery, we see that part of the reason it catches the eye subconsciously is it comes in narrow and then comes out again wide down here. And by creating a more balanced nasal tip such that this outturn here is a little bit less acute, we can actually achieve something which is a little bit more balanced for the patient and very natural appearing.